So I want to start by asking you an important question. Spot the veteran athlete. I know it's very difficult, and I think the double chin doesn't help. But you may all recognize the chap on the left as Haile Gebrselassie, who is a 2 times Olympic gold champion and 4 times world champion, considered by some to be the greatest runner of all time. What's striking about Haile Gebrselassie is that he is 41 years of age, so by definition, a veteran athlete. And when I met him in last year's London Marathon, where he was the pacemaker, he wanted to break all master records, over 40, over 50, and over 60. So he wants to carry on. And he's not alone. There are a number of notable veteran athletes who have taken up sport throughout their whole lives and continue to exercise in their mid-30s and early 40s. But that is not just confined to competitive or professional athletes. There's also the recreational, amateur athletes who are growing in numbers. If we look at this graph as an example, taken from the New York Marathon in 2012, and you can appreciate that in both males and females, in the middle age categories, there is an increase in participation numbers, which decade on decade. And what's interesting, in the younger groups of endurance participants, there seems to be a drop. And if we extend this to ultra marathon runners, so people who do 24-hour races, you can see the vast majority are actually in the middle ages. So is this a midlife crisis, or is this a group of athletes whom we need to start thinking and acknowledging about? And I think the latter is probably true, in that these athletes are well governed by international and national bodies, which encompass both competitive and recreational veteran athletes. So, what is a veteran athlete? By definition, it is an individual who's been exercising for the majority of their adult life, who's over the age of 35 years. And in some cases, they're also referred to as master athletes. So, much of what we hear today would be about the young athlete's heart, which undergoes electrical, functional, and structural adaptation to exercise. And much of what's being published in the literature from colleagues in this room and from within our group is on the young athlete's heart. But when we think about veteran athletes, we may need to perhaps look at things in a slightly different way. So whereas a younger athlete at the age of 35 might hang up their boots and look for a career in television, a veteran athlete will probably continue exercising way into their mid-40s, 50s. So it's a good model for assessing the chronicity of exercise. And this is Steve Redgrave, who's a patron of CRI, and who has exercised way beyond his mid-30s and 40s and achieved 5 Olympic gold medals. So if we take a young athlete's heart and subject it to lifelong endurance exercise in the setting of a normal aging process and subject to toxins and infections, lifelong cardiovascular risk factors, and in the setting of possible genetic predisposition, what actually happens? Well, as it stands, we don't know the answer to that. Looking at animal models, so this study performed by Benito et al., published in Circulation in 2011, looked at rats who were exercised for 16 weeks, which in human terms is around 10 years. And these were compared to sedentary rats. And after 16 weeks of training, they actually found that they have larger cavity sizes and fibrosis in nearly all the chambers. And what was striking, there was diastolic dysfunction and ventricular tachycardia in 42% of the rats. Now, does this translate to humans? Well, study published from our own group, assessing 12 lifelong veteran athletes, found that 50% of them had late gadolinium enhancement. And for those who are not familiar with cardiac MRIs, late gadolinium enhancement is a marker of fibrosis or scarring in the heart. And the vast majority of those athletes had a non-coronary artery disease pattern, which is a patchy distribution of fibrosis. But there were limitations to the study because there was a small number. A much larger study, looking at 102 marathon runners, aged 50 to 72, found that 12% of them had evidence of scarring, which was not significant, but was quite obvious. Most of them had a coronary artery disease pattern, and 5 had this non-specific, patchy areas of scarring. The same athletes were followed up for 21 months, and 4 of them had coronary events. But there were important limitations to the study. First of all, like the previous study, all the athletes were males, and 50% of them had a history of smoking. In the same study, they looked at coronary artery calcification, which is a marker of coronary artery disease. And what they found was quite interesting in that 36% of the marathon runners had a calcium score of over 100 compared to 20% in the controls. So far I've told you that these veteran athletes may have fibrosis, may have accelerated atherosclerosis, but does this relate to the arrhythmia burden that they also have? There's been several studies performed on this, and it shows that retired athletes or chronic endurance athletes do have an increased prevalence of atrial and ventricular arrhythmias, and in particular atrial fibrillation. So this study, published by Abdullah et al., looked at, was a meta-analysis of various studies which describe atrial fibrillation in athletes. And as you can see, there is almost a 5-fold increase of developing atrial fibrillation if you engage in regular chronic exercise. So what does this translate to? And do these veteran athletes, bearing in mind all the things that I've mentioned, do they live longer? There's been a lot of studies in Italian athletes, in Finnish athletes, in Olympic gold medalists, and in tennis players, and most recently in retired Tour de France cyclists, that show that there is a clear longevity benefit of chronic exercise. But what is driving this? Is it purely the exercise alone? Or is it the fact that these individuals are more likely to live a healthier lifestyle, in that they are less likely to smoke, observe a healthier diet and a normal weight? Or is it a genetic pre-selection, in that are these athletes, because they're gifted of good genes, they live much longer, and hence why they're athletic in the first place? Here's an intriguing study published in The Lancet 2011, and it looked at the types of exercises which were separated into moderate and vigorous. And what they found that with moderate exercise, there's almost a linear pattern. So the more moderate exercise you do, the all-cause mortality, reduction in all-cause mortality actually increases. Whereas with vigorous exercise, up to a certain point, the graph starts to plateau. And this is bearing in mind, this is 50 minutes of exercise per day. Now, a veteran athlete, and most athletes, would do far beyond that. So we don't know what this area of the graph will be like in people who train very hard and over long periods of time. So how do we gauge who is at risk? Well, if we look at the current guidelines, both published in Europe and in America, they will be insufficient to exclude coronary artery disease in these athletes, as well as scarring and paroxysmal arrhythmias. and this is data that was presented at Europe event of this year, that shows in a national survey of almost 500 veteran athletes, there's quite a significant cardiovascular burden in terms of arrhythmias and in terms of symptoms. So this is a difficult group to screen. So there are important questions. First of all, we don't know what the normal spectrum is of cardiovascular adaptation to chronic endurance exercise. We don't know if we exclude risk factors, which was a major, one of the major limitations in the studies that I mentioned, what proportion of veteran athletes actually do have fibrosis and have coronary artery disease. What are the consequences and causes of these? How can we screen veteran athletes? And most importantly, we know nothing about the female veteran athlete. So, at St. George's Hospital, together with Lewisham Hospital and the Heart Hospital, we've devised a veteran athletes heart study, where we're looking at 150 veteran athletes, comparing them to 150 veteran controls and young athletic controls. And all of these individuals undergo a multitude of tests, inclusive of cardiac MRI and CT coronary angiography. Just to add, the study was initially funded by Cardiac Risk in the Young, and we're very grateful for that. And it's also being funded by the British Heart Foundation and supported by the National Institute of Health Research. So this is work in progress, but I would like to share with you some interesting cases that we've come across. So this is a 40-year-old veteran endurance athlete who's done over 150 endurance events. When he presents, he's in the best shape of his life, and his VO2 max reflects that. But if you look at his ECG, there is clear atrial flutter with variable block. And his echo shows this rocking motion, which would be inconsistent with atrial flutter. But despite that, he does very well, and he's producing personal bests. So clearly, some of these arrhythmias are not limiting these athletes. If you look at another veteran athlete who has done over 100 endurance events and is a very good marathon runner, who has a normal ECG, echo, and again, an excellent exercise test. So this is his cardiac MRI, which shows a non-dilated left ventricle. But if you look very closely at the apex and the septal wall, there's a very mild hypokinesia. And on injection with late gadolinium, you can see there's areas of scarring in the septum and apex. And this is consistent with an infarct. The same chap went on to have a CT coronary angiogram, and you can see there is a lesion in the left anterior descending artery, which will be consistent with the scar that we've seen. Same veteran athlete on Holter monitoring has an irregular, what looks like to be an interventricular rhythm. But is this due to the fibrosis and perhaps the coronary artery disease that was seen? And this is another veteran athlete who runs 35 miles per week and done, again, a lot of endurance events. And just like the previous endurance athlete, there is almost a similar pattern of fibrosis in the septal wall. So we would expect him to have a similar lesion in his left anterior descending artery, whereas in fact his calcium score is actually 0. So how can you have a definite infarct on an MRI in the setting of a normal coronary angiogram? The honest answer is we yet don't know. And this, finally, is the last athlete. So his cardiac MRI shows a preserved left ventricular function. You can see this mid-wall patchy fibrosis, which has been described previously, again in the setting of a completely normal coronary angiogram. So, to conclude, veteran athletes are a unique and growing population of athletes. We know very little on the chronic cardiac adaptation to exercise. At present, there are more questions than answers, in particular with regards to myocardial fibrosis, arrhythmias, and coronary artery disease. But we think there's probably multiple factors at play, including age, lifelong risk factors, exercise, and perhaps an underlying acquired cardiomyopathy. And our study on veteran athletes aims to unravel the mystery of chronic endurance exercise. So thank you very much, and I'd like to invite you.